Bueno, hola, buenas tardes.
Hello, good afternoon. I am Vanessa López from Foundation Salud por Derecho, and I wanted to thank Cogam for the invitation today, and particularly Enrique Poveda. I must confess that I had some doubts because I wasn't sure how to approach the presentation. I didn't know whether I would face an expert activist here or what kind of audience I was going to find, people who wanted to be activists. So excuse me if I talk about things which are very basic and everybody knows. So Salud por Derecho is an organization that defends human rights and human beings and their right to health. And they are a political activist. The organization started 14 years ago and precisely started in order to have the political will and to demand the Spanish government in order to establish measures, particularly helping the more underprivileged countries and communities. So one of the aims, one of our objectives has been to get funds and support to fight against AIDS in all over the world, in some, as I said, underprivileged countries. And more recently, we are trying to develop a campaign in the social society in Latin America, which is still not public, with the aim that to bring this to the social sphere. The fact that the donors, some donors have stopped. Some countries have stopped receiving international aid and support. And so this is important, which groups are going to stop being helped and funded. And also the effect in the loss of financial aid that the civil society is going to experience, which is a kind of action that the local countries doesn't normally fund. And also the drugs is the right to drugs is one of the most common issues. I will explain what I'm referring to in terms of drugs. So we are trying to give solutions to this problem. Well, first of all, this is a very generic map because my intention is to give you a generic idea of the context in terms of access to drugs. So currently, only 47% of the people who have HIV in underprivileged countries have access to drugs. So if you actually look at this data, perhaps you can't see it. The access is very unequal in the different regions. Obviously, sub-Saharan Africa is where the access is more restricted. The majority of countries, less than 28% of the HIV-positive population have access. In Latin America, is 50% of the population has access. But let's say it's important to have these figures to see what are the fundamental barriers, apart from the fact that some key excluded population have specific barriers to the prevention, healthcare, plus the loss of economical resources is one of the main obstacles. We must say that the more underprivileged countries, the treatment is being paid by the international aid. So in these countries, so that about 10 million, the treatments are paid by the World Fund. So this tool actually is been well designed and it has coherence, consistency. And one of the fundamental barriers also is the price of drugs, which is what I'm going to talk about. Also, the problem of having access to drugs. So it goes beyond the HIV context. there are many other drugs that people need and they don't have access, to hepatitis and so on. So as I was saying earlier, the price is one of the main barriers, and indeed the price is important. The other day I was in a conference with medical societies and farmers, and they were very bothered when we spoke about price. Especially in a country like ours. But of course the price is very important, because in the poorest countries, where people basically, if they don't have access to to drugs, they just die. But also the very high price of drugs is actually questioning the health systems around the world, in Europe and around the world. For example, in Spain in 2015, the pharma bill of all the drugs dispensed in hospitals, all kinds of, was increased by 23%, despite all the different cuts that the health system has experienced. But also the high price of drugs also prevents more patients from benefiting, and in many cases, what it does, it limits the access to drugs from patients for patients. And up until recently, there hasn't actually been a commitment that all the patients in any of the phases could be treated, precisely because of the high price of drugs. So here I've just taken two drugs with the prices in Spain. I want to thank my colleagues from EGF that they've provided me with this information. Well, if you look at this, different prices. So the price in Spain for these drugs per year is the first column, and the second column is the price in Argentina. As you can see, for example, in the case of Trumec, the price is really huge, it's phenomenal. So this is one of the problems that we are seeing, that the prices of drugs, not just for AIDS, but other health issues, is very high, much higher than the one that we pay in developed countries. This is an issue because, as we said, these countries are not in the not part of the development programs, support programs, so they don't have external resources, so they are at a great disadvantage when it comes to negotiate prices and to be part of group buys. And of course, these countries are outside any program, let's say voluntary licenses, that the big farmers agree with our countries. Let's say they are going the most underprivileged part of this, and it's an important challenge. The question is, why are these drugs so expensive? Well, there are two reasons. One is that the current system of development of drug development is based on monopolies, the patents, and what they allow is to have exclusivity for at least 20 years. The sale of that drug, so they have monopolies, so they can actually they can choose any prices they want. And the other reason is that the way in which these prices are fixed is very interesting. It's peculiar. On the one hand, the price paid by governments and hospitals, as in the case of Spain, is completely obscure. We don't really know what are the real prices being paid. On the other hand, that actually limits the ability to negotiate. And on the other hand, it could be logical to think that in any other industrial sector, So we speak about drugs as if there was any other product, but normally in other sectors the prices are based on the cost, on the research cost, plus a reasonable margin of benefit. This is not what really happens in the sphere of drugs. They are fixed in a very arbitrary manner, and it depends on what each government is willing to pay. When we talk about people's lives, so we are willing to pay a lot of money. Also, the pharma industry usually justifies the high prices of drugs because they say that the investment they make is very high. Lately, they're even talking about 2,000 millions, which is the cost of developing a new drug. But there are also studies which obviously challenge this myth. The study by other economists say that we're talking about $300 to develop a new drug. Data that from a research group in Liverpool says that in the United States is $84,000 per treatment. In Europe, it would be around 200 to 300 euros per treatment. So I mean, and this is similar to the drugs for cancer. We don't have data related to estimated costs for HIV, but we could actually make a similar projection. Therefore, the myth of the high cost that the pharma industry normally has, and they argue their costs in this way. There's also the part of clinical investigation or research, and also the laboratory research. And this is actually paid. The public health research is paid by public money. So the fake myths that the farmers actually use these arguments, and so we can demystify these arguments. And I would also like to mention that the movement for the access to drugs is changing. As you can see this in this photograph, is of this is the World Conference of AIDS last year, and you can't really see, but the banners that people are wearing are talking about Roche, which is a big pharma that produces drugs for cancer. So they are actually, in the case of South Africa, they are actually being complaining. There's been demonstrations, and really represents what I'm talking about, that we're going through a new phase. And activists, HIV, were demonstrating for the access to drugs against HIV, but this is a very similar case for the hepatitis B. In the case of hepatitis C, as was shown in Europe and in the rest of the world, that there is a great lack of access. And also it had shown that these problems, the problems we are experiencing with drugs, is a systemic problem affecting all the different spheres, all the different conditions, and not only with drugs that they do exist now, but the research that is actually providing a huge benefit to the farmers, for example, in pediatrics. So we are at a moment where, thanks to the crisis that there was with hepatitis C, that the governments in Europe and developed countries are starting to understand that it's necessary to change the model of the innovation model of drugs. So there are different initiatives from institutions that are actually analyzing this issue. Also, from the civil society, this has been reflected in how we are approaching these issues. In the old days, the HIV community, HIV-positive community, was focusing on using tools related to intellectual property in order to open up to new generic products. So, for example, this campaign that is taking place in many different countries, like Ukraine and so on, they're using ways of opening up the patent, where they're going to appeal, in this case, to the agency, to the European Office of Patents, because it's considered that this is not justified, whether it's hepatitis C or cancer and so on, which has been, for example, Médecins du Monde have been doing this with the second patent of another drug. And there are other initiatives that are being put on the table that are trying to, let's say, link this general problem with all the different with the case of Noesano and some of the Spanish campaigns, or for example, the European Alliance for Responsible R&D and Affordable Medicines. So what we are seeing is, well, what solutions can there be to stop this problem so that we can anticipate to having to do an opposition to the patent. This is when a government considers that the price of a drug is very high, and so what they do is to force this company that has the patent that they produce the generic product. So they allow the license to produce the generic product without the brand. So this is, let's say, the last phase of this chain, and this solution is not an immediate solution because there are other barriers in this process, and the process of producing generic products, not branded products. So we are actually looking at solutions so that these same issues don't take place again. So one of the main things is transparency when it comes to prices, and also the different public investments that are being made in any of the different drugs. If we know what are the inversions we made, our negotiating ability is going to be bigger, or how decisions are made about how to approve or what drugs to approve. And this is an important part in order to sort out the problem. Public investments that can have an influence in the different drugs that come. They have to make sure that there is access to this drug if it's finally developed. How? So there has to be a regulation. For example, a public laboratory of a university, if they develop a molecule that is very promising and then they have to have a license, that there has to be a license that is not exclusive so that they can be a competitor. And then we would eradicate the problem we have now. For example, license agreements that they can assure that the price is accessible. And there are many formulas, but the main thing is that there is the political will to carry this out. And another thing we are asking is that there are research initiatives that are alternatives to the current model. And that, as we said, is based on patents. So, for example, to fight against poverty or other initiatives for conditions or drugs where there is an interest of the pharma industry. That would be very interesting, because that would allow the development of drugs which are interesting for the public health, such as generic drugs. And so the private sector would be also allowed to take part and establish reasonable prices, and not the ones we have nowadays. And finally, as I didn't know the kind of public I would have, so I wanted to make a comment about 3 films that deal with this problem and the access to drugs. And they talk about a history of activism, which I think is interesting to know, and I'm sure you all know for the faces I am seeing. And that they explain where we are coming from and where we are, and perhaps where we are going to. Thank you very much.